Dr. Ankur Saha, FUE surgeon at Enhanced Clinics. Today I'll tell you everything about hair transplant surgery, how safe it is and why you should go for it. Hair transplant is in trend and more people are opting for it. Hair transplant is a miraculous invention of science which makes hair regrowth possible in the most effective and painless way. What is hair transplant and how is it done? When patients come to me, I see that they first don't actually go for a hair transplant when they require it. People, unfortunately, fall prey to misleading advertisements. They get attracted to so called cheap substitutes, which claim to give new hair follicles when they actually don't do anything. Let me make it very clear, there are medicines which work for hair, but all of them are meant to strengthen your existing follicles and bring your hair fall to a steady decrease. None of them can actually give new hair follicle that a hair transplant can give. Is hair transplant painful? Not at all. It's done under local anesthesia. Only the scalp is made numb. Patient is awake throughout the procedure. Patient can watch TV, listen to music. By the end, patient can go back home. There's no need to stay admitted. In hair transplant, there are two techniques, the follicle unit transfer and the latest being FUE technique. Today I would like to throw some light on FUE technique. FUE, as the name suggests, follicle unit extraction, is a technique in which about 2 to 4 hair follicles called follicular unit is extracted from the donor area with micro punches. Okay, there's no linear cutting, there's no linear cuts, there's no sutures which is involved in this procedure. Only the area is made numb, follicles are removed with a punch and they are implanted in the areas which have gone bald. Oral medications are only for 5 days post-surgery. The best advantage of FUE technique is that the post-operative comfort level is much higher. Patients are comfortable to join with their office work the very next day post-procedure. They just have to take care, and there are few restrictions like no heavy exercise or swimming, gymming, no cutting, drying of the transplanted hair, no smoking alcohol, that too only for 3 weeks. Hair transplant is a very minimally invasive procedure done under local anesthesia. It is only a skin procedure, nothing to do with your skull bone, brain is much below that, so it's a safe procedure. Always choose, most importantly, choose a clinic which has got good reputation in doing hair restoration surgeries. A doctor is the right person to tell you, to guide you, what is your requirement, do you require a transplant, and if so, how many follicles and what area can be done. There are many reasons of hair fall. The commonest in males being androgenetic alopecia, what we call as male pattern hair loss, in which people lose hair because of DHT as a hormone and a genetic history in their family, where hair is lost in grades, as grade 1 to grade 7. Usually it begins with thinning of the frontotemporal angles, thinning of the vertex, and eventually in grade 7, which is the last grade, there's only hair left at the back of the scalp. These permanent donor area, what we call as, is utilized for a hair transplant where follicles are removed one by one and it is implanted in the areas above. FUE has broadened the scope of hair transplant, where now with FUE technique, other than the scalp donor area, follicles can also be extracted from beard area, from chest, from upper back, from the nape of neck when we want finer hairs, say for eyebrow hair restoration. But again I repeat, most importantly, choose a clinic which has got good reputation in performing hair restoration. Make the best decision for you, and in 6-7 months when you get the results, you'll be amazed to get your new look with new hair follicles that you've always desired.